Welcome to our series on the new code of professional practice. Today we're focusing on clinical practice, safety and quality. This part of the code covers what chiropractors must do to keep patients safe, deliver care to a consistently high standard and respond appropriately when something goes wrong. I'm joined once again by Nick Jones, Chief Executive and Registrar at the GCC, and Andrew Fielding, Policy and Insights Officer. Welcome to you both again.
Thank you.
Good to see you, Julia.
You too. So listen, let's start off with clinical practice itself. What are the key themes that chiropractors should take from the new code?
I think the first thing to say is it's a truism, isn't it, that the fundamental role of the clinician is to keep patients safe. It's also true that robust systems of safety and clinical care keep patients safe.
Mm-hmm. Yeah, so we refer to that as a culture of safety. All through Principle B, we're asking chiropractors to look ahead and try and prevent harm before it occurs, spot those opportunities to just keep improving your practice, improving how you do things and keeping people safe. And when you see those opportunities, it's also about sharing those and getting helping the whole profession to learn. We want people to be able to say, actually, this happened, it was fine, but here's how we're going to prevent it happening again. Here's what we can do as a profession to develop. It's also about knowing where your own limits lie as a practitioner, looking out for, actually, this is getting to a point where I need some help. I need to refer on to another chiropractor, or I need to refer to another healthcare professional, so that the quality of the care that patient receives is tip-top. It's the best quality that you and your colleagues can provide. And then it's about looking back at the care you've provided and spotting those where things have gone well and what can you learn from that, so that you're always improving and developing the quality and the safety of the care that you're providing.
So sharing learnings, sharing best practice, and then also seeing safety as an active everyday endeavour rather than just a box ticking exercise.
Absolutely, yes.
Okay, let's talk about first aid. What is called out about first aid specifically in the new code, and what other aspects of emergency preparedness are there?
Firstly, instances where an emergency response is required are, whether that's first aid or anything else, are mercifully rare. And it's a motto, isn't it? The importance of being prepared is crucial in this regard.
And that's it. That because they're so rare, it's so important that, because those are the moments when you're really tested. Those are the moments where you really come into your own. You need to, that professionalism needs to come through, because as a healthcare provider, as a healthcare practitioner, the patients are looking to you for that confidence and that ability in those situations. So we want to know that you've got the procedures in place, that you've thought about the sorts of emergencies that can arise, and that you keep revisiting that, and that you keep practicing and developing your skills in those areas, so that when that situation does arrive, and mercifully, as Nick says, they are rare, but when they do happen, that you're able to deal with it to the absolute best of your abilities.
Right, so it's not just about having a first aid box in a cupboard somewhere. It's a little bit more about that readiness piece.
It's about the readiness, it's about the practice, it's about being able to use the equipment that's in the first aid box, for instance. It's all very well having the fire extinguisher in case of a fire, but do you know how to use it? Is it serviced regularly? Is that culture of safety throughout everything that you do, is that there?
Okay. The code also mentions mental health for both patients and professionals. Can you tell us about what is covered on that?
Well, we know that chiropractors are great at seeing the whole patient, and it's really important, isn't it, that you see the patient in front of you, the whole patient in front of you. And we know that the physical characteristics or the issues are often what brought the patient to the chiropractor, but the overall mental health and well-being of the patient is a critical factor.
Yeah, and for the chiropractor's point of view, you cannot provide that fantastic care for the patient if you're not caring for yourself. So there's a new standard in there about actually being conscious of your own mental health, being aware of where you might need some help, or where you sort of are struggling a little bit. It's going out and seeking help, being aware that you need to find other people to provide support to you as well.
So it's about compassion in both directions and even recognising vulnerabilities, both in patients, perhaps also in yourself. Let's move on. Safeguarding has been strengthened in the new code. What is new in that respect?
It's important to underline that we've all seen instances of terrible safeguarding failures across the news. One of the common features of a lot of those cases is that someone has assumed that it's someone else's responsibility to deal with those concerns. And I think I would like to emphasise that the importance of everyone understanding that we all have a duty to act in the face or in the light of a potential safeguarding risk.
So, coming back to what I was saying about being prepared, you need to think in advance. If you come across a case where you are concerned about an individual, for whatever reason, trying to look locally, find out what is your local safeguarding procedure. It'll depend from individual to individual because practice across chiropractic is so different. So it might be that if you're in the NHS or you're working in a university, there may well already be systems in place. But if you're working in private practice, then you need to do a bit of research. You need to have a plan in place, have a policy around if this sort of situation arises. And think about the sorts of patients that you see and the situations that you might come across. Try and work out where would you then refer those people on to.
So the theme very much is knowing in advance, in order to prevent an issue, knowing in advance, in this case, where or who you will refer to for safeguarding.
Yeah, so much of that culture of safety thing is about being prepared, looking out for those opportunities and knowing what you're going to do.
Okay. One last area under clinical quality, and that is continuous improvement. What does that look like in practice and how is it referred to in the new code?
What was it I heard recently when someone was talking about the experience of a newly qualified chiropractor or someone who's been around a bit, and the question comes back to, does experience make you wiser? The answer to that is unless you're reflecting and thinking about improvement, experience just makes you older. So really important to reflect on your learning and how you can improve your practice.
Every patient you see is an opportunity to grow and reflect in that way. So chiropractors will be used to talking about PROMs and PREMs, which are outcome measures and evaluation measures from patients. Carrying out those sorts of surveys, thinking about the responses that you get from patients, understanding the patient experience of your care, and then think about what works, what's great, what do we do, what do we need to do more of, what do we need to continue doing, and then looking for actually that maybe patients don't like that so much, maybe that's not what they're looking for, and using that to experiment, to try developing your practice. So it's a constant learning journey, chiropractic, isn't it?
Okay, we're now joined by Gay Swate, Associate Professor and Head of the Chiropractic Curriculum at Coventry University and Director of Research for the Royal College of Chiropractors, to explore some of the common questions that chiropractors ask about clinical safety and quality under the new code. Gay also helped the GCC develop sections of the new code. Welcome, Gay. Nice to have you join us. So first off, what does safe practice really look like in day-to-day chiropractic care?
So it's important to say, firstly, that safe practice refers to anything at all that can go wrong, not just with patient care, but any aspect of them being in the practice setting. It might be due to avoidable errors or accidents or unavoidable things like medical episodes. So firstly, prevention then of harm is key, and that means having in place clear systems, policies and procedures. It means accurate notes, good communication with patients and other health professionals, and safe equipment. And it also means knowing your limits, recognising when to stop, refer or seek guidance. Most safety issues arise not from lack of skill, but from small lapses in attention or routine. After prevention then, it's about being ready to respond. Safe practice is about always being alert for risk and acting quickly and effectively if something does go wrong.
And what should chiropractors do if a near miss or even if a safety incident happens?
So everyone encounters safety incidents in practice at some point. Safety incidents, including near misses, are really important learning opportunities because they bring the benefit of hindsight, if you like, which really means reflecting, learning, and doing things differently as a result. So they should always be documented, reflected on, and where appropriate, reported to disseminate learning. All chiropractors can use CPiRLS, the Chiropractic Patient Incident Reporting and Learning System. This provides a completely secure, anonymous and confidential way to record incidents and share learning across the profession. The goal isn't to assign any blame, but to understand what went wrong, what might have contributed, and what can be improved to avoid recurrence. Learning from these moments and aiming to reduce all avoidable harm is one of the best ways to strengthen safety culture.
How should chiropractors handle emergency situations? So, for instance, if they spot a patient with some red flag symptoms?
Being prepared is really essential. So the Royal College of Chiropractors has developed an emergency referral form specifically for situations where you suspect a patient has a condition that needs immediate referral to an A&E department. When completed properly, it communicates all of the key information that A&E clinicians need for effective triage. So chiropractors should have this form saved and immediately accessible in their clinic system. Read through it in advance to understand what information it asks for and make sure anyone working with you knows where to find it. If you're prepared, completing the form to communicate your findings takes moments, and once it's filled in, you instruct the patient to present the form to their nearest A&E department without delay, i.e. that would be the same day, or if relevant, you could pass the completed form to ambulance staff and then document everything in your notes, including keeping a copy of the completed form. So the form is there to support you, but preparedness is what ensures the referral happens efficiently and safely.
Right. We've been talking about the importance of preparedness for all eventualities and emergencies. How would you like to speak to that, Gay, when it comes to chiropractors in practice, particularly if they work alone?
Preparation is the difference between panic and professionalism. Have a clear emergency plan, know where equipment is, who to call and what to do. And even if you practice solo, keep contact information for nearby colleagues or neighbours and practice those scenarios occasionally. It builds confidence when seconds matter.
Right. And Andrew, what should chiropractors do if a patient does show signs of mental health distress?
So, you know, as a chiropractor, that physical pain and mental health are very often quite closely linked. So it's not unusual to come across situations where you have concerns about a patient's mental health. And the key thing, you're not there necessarily to diagnose any issues, but you are there to refer, to help them, to support them. So again, coming back to this idea of preparedness, know who your local services are. Those are the experts. They're the people that you can advise the patient to speak to, or in circumstances where you have really strong concerns, actually make these services aware of your patient within the expectations of the code.
So it's a lot about looking out for signals. Nick, what about if a chiropractor suspects abuse or neglect but isn't sure what to do?
I think if you see something that looks like a safeguarding concern, your instincts are probably right. And then it's your duty to act and to take necessary action, and that involves understanding what the local safeguarding arrangements are and who to contact.
Right. And then, Gay, just one more question for you. What can chiropractors do to promote a culture of safety, which we've been discussing, in their clinics?
Lead with openness, encourage colleagues to speak up about mistakes or near misses, and really focus on learning, not blame. You can review incidents together, update procedures, and share lessons. And a culture of honesty really is the strongest safeguard a clinic can have.
Thank you very much. Well, before we close, I'd love to just get one key takeaway from each of you that you'd like to leave the folks reflecting on. Gay, let's start with you.
It's about culture. So my takeaway is create a culture of care where safety, openness, and compassion guide every decision that you make.
Thank you. And Nick?
As ever, be prepared. Preparedness and vigilance leads to safer care.
Great. Andrew?
For me, it's about that continuous journey of learning, always looking for those opportunities to learn from your practice, learn what you can do to create a safer, better environment for providing care for your patients.
Well, thank you to all three of you. And you can find the full code of professional practice on our website at gcc-uk.org. The GCC newsletter will help continue to share updates so that you can be prepared for the new code, and you'll also find supporting content and guidance on our social media channels. Thank you for watching.